Tonight, public health in a pandemic. That was the topic of a Zoom meeting with the Otsego County health officials. News Channel 2's Caitlin Erla joins us now live in studio to tell us more about what was discussed. Caitlin, good evening.
Good evening, Jason. Well, the whole idea behind this discussion was to continue educating the community on the coronavirus and let people know what Otsego County is doing to help prevent it following the outbreak at SUNY Oneonta. The health officer for the city of Oneonta spoke about how the city has been monitoring the virus. One way is wastewater testing, which has been used for decades to look at the prevalence of viral illness in populations and identify outbreaks.
In concept, this provides us with a tool of understanding how much virus, how much infection is present in a community without having to do individual testing.
This also helps target where testing is needed, and that's where pool testing comes in.
If you have a group of 100 or 200, what the pool testing allows you to do is group a number of tests, and these specifically are saliva tests now looking for the virus. So maybe 10 to 25 of these pooled samples are analyzed at once, and what that does is allow you to sample more tests more quickly.
The turnaround time for pool testing is usually a couple of days. People did submit questions during the meeting. A few people were wondering how important masks have been at containing the spread of the virus in the community following the SUNY Oneonta outbreak.
It's generally been shown that where masks are consistently worn, that the number of secondary cases goes way down.
And as the pandemic stretches into the fall, there are other benefits to wearing a mask.
We're going to have flu season and COVID together is quite challenging. And so I think wearing masks is also going to be very helpful in preventing influenza spread as well.
Jason, these health officials say it's important to keep the community updated during times like this, especially because the circumstances surrounding this pandemic are always changing. Back to you.
Caitlin Erla, thank you. Going county by county with